Hi, I'm Dr. Robert Kohen. I'm an orthopedic surgeon at UnaSource Surgery Center. Welcome to my office. Outpatient surgery has really progressed since I've been in practice for about 10 years. It was initially just arthroscopic procedures using a camera, little 10, 15-minute procedures. Now it's grown all the way to joint replacements. We're doing hip, knee, and shoulder replacements in the surgery center. Patients go home the same day. It's interesting, we'll do the case and go have a cup of coffee, and the patient will be walking with a physical therapist in our hallways by the time I'm done. It's really incredible. Those used to be patients who were admitted to hospitals. They stayed 7 days back when my father was in training, and now they're home by lunchtime. I'm actually the son of a surgeon. My dad's an orthopedic surgeon, and that's something I grew up seeing in my house. I think that it was impossible not to see his joy in taking care of people and in his profession. That sort of piqued my interest in it at a young age. It's interesting that we still have that interplay and bounce cases off each other. Occasionally people come in and see me as Dr. Kohen and are expecting a guy who's 70, which is sort of funny. But I think growing up as a son of a physician, you sort of have a different outlook on how those things are done. I started out at a hospital system as an employee, and I went into private practice, and I went to 10 different hospitals in the area, a couple surgery centers all over the place, just checking them out to see where I wanted to be. And as soon as I came to UnaSource, just the professionalism, the expertise of the anesthesiologists, the expertise of all the staff, the cleanliness of the place, the ability to do high-level work similar to where I was in my fellowship, which is one of the better places in this country, immediately I knew this is where I had to be. Coming here, you park 10 feet from the door, you walk in, it looks like a nice hotel lobby. You're in a nice wood-paneled room that is yours for the day. You have the same nurse before and after surgery. We have the same anesthesia people. They don't do shift work. They're here for your entire case. And I just think that there's no place in the area where higher level care can be provided. This is the safest, best place in the area, without a doubt. So many patients from whatever generation they may be say, I feel like the hospital's safer. What if something really terrible happens to me? It's a reasonable question, and there's a couple things. First of all, we know it's safer to have surgery here than to drive to the surgery center, and we don't think about getting in a car and driving anyplace. I think also what I would say is I've seen complications here. I've seen things happen, and I'm much more confident in the staff we have here than any place I've ever met. One of my friend's daughters has 2 brothers. She took a high stick to the eyebrow. She was about 3 years old, and he said, should I take her to the ER? What should I do? She needs stitches. I said, no, I was operating here. I said, you should bring her here, for sure, no question about it. And she's 3 years old. She was under anesthesia for about 5 minutes with our great anesthesiologists and CRNAs. We stitched up her eye. Within 10 minutes, she was up eating a popsicle. We're trying to improve every aspect of everything that we do. So we're trying to do surgery in a more efficient manner. We're trying to make patients recover faster. We're trying to make whatever we're putting in the patients last forever. We're trying to make them have less pain, return to work, return to their sport as fast as possible. We're approaching that from every possible angle, from the robotic mechanical side, from the anesthetic side, from the rehabilitation protocols that we have, just sort of fine-tuning all of these things to optimize everybody's outcome. One of the more recent things we started doing here is reverse shoulder arthroplasty. These are shoulder replacement procedures for people who have both arthritis as well as a rotator cuff issue, typically. I had a patient who was referred to me by a friend of a nurse anesthetist here, and he came to see me, and he didn't know me, but he trusted her. We did the procedure here. It took about 45 minutes, and within 2 days, somebody told me they had seen him at the gym, walking on a treadmill in his sling, and they wanted what he had. And I said, well, you can only have that if you need that, but I'm happy to help you. And so it's just remarkable that people are really returning to their activities, and they're not screaming in pain or having these experiences you heard about way back when. It's just not how things happen anymore. And where am I going to take my own kids, my best friends' kids, my own parents and relatives? I think this is the safest place. And I mean that from the bottom of my heart, that if I have a problem, I'd rather be here than any place else.